So, Bismillahirrahmanirrahim. So, today we'll learn about classification of parenterals. Injectables की जो classification पहली की class है, official types. कितने type के उसके फार्माकोपिया हैं, किस फार्माकोपिया से क्या इंजेक्शन बनाया जाता है, क्या पेरेंटल बनाया जाता है. ऑफिशियल टाइप्स है यूएसटी, बीपी, एनएफ, व्हाटएवर. ओन स्पेसिफिकेशन ऑफ द मैन्युफैक्चरर्स, दिस कैन पॉसिबल. फिर सेकंड है वॉल्यूम बेस्ड है, स्मॉल वॉल्यूम है, लार्ज वॉल्यूम है, छोटे इंजेक्शन है या बड़े साइज के इंजेक्शन बनाए जाते हैं. स्मॉल वॉल्यूम और बिग लार्ज वॉल्यूम इंजेक्शन जैसे ड्रिप्स हैं, इन्फ्यूजन्स हैं, छोटे इंजेक्टेबल्स हैं. देन टाइप ऑफ पैकेज, किस तरह की पैकेजिंग उसमें है, प्लास्टिक में है, 3M स्मॉल में है, बड़ी में है, मुख्तलिफ पैकेजिंग पढ़ेंगे. फिजिकल स्टेट उसकी किस तरह की इंजेक्टेबल की. तो विल डिस्कस अबाउट क्लासिफिकेशन ऑफ parenterals. So one by one we'll say. So in official type injection, you can see that in pictures different types of. The upper side is one ampule. It is known as ampule. The lower side is vials. These are known as vial. So injections, for injections, injectable emulsions. There in emulsions, injectable suspension, होंगे. So injection. Some are injection only for injections, second injectable emulsions and the suspensions. So these are different types of injection. You can see nowadays different types of injector available. Ampules, so there's vials, there multi-dose vials are there. There's so many types of injectables are available. For the type of packaging, now single dose units, ampules, pre-filled syringes. Nowadays, mostly the pre-filled syringes. You can see in this picture, pre-filled syringes. Yes, the drug is included in a syringe, and that can be injected at that time because injectables are applied with the help of a device. So sometimes you have injectables, you don't have device. So what they do, they have in smaller volumes, they put the medicament inside a syringe, and that is known as pre-filled syringe. So ampoules, these are single dose units. Once they use, then they can be discarded. Then infusion solutions, infusions larger volumes. Then the multiple dose units. Sometimes in mostly in insulin are available in multi-dose units because you take out the dose, then it has to be injected. So similarly, the volume, so small volume parenterals of less than 100 ml, they can be of injectable of small 5 ml, 10 ml. These are known as small volume parenterals. Then large volume parenterals, 100 ml or more than that. There can be nutritional, parental nutritions, whatever they are, more than 100 ml. So there's two types: small volume parenterals and large volume parenterals. Then physical state, sterile solutions, some sterile solutions, second sterile suspension, sterile emulsion, sterile solids. So these must be for injectable. As I told in definition, these are sterile. Sterile means free from any any microorganism or their products. So they are free from first sterile solution, sterile suspension, sterile emulsion, sterile solids. These has to be used as a type of parenteral preparation. Then they go for the solution and suspension of drugs and tender for injections are prepared in the same general manner as solution and dispersed system with some differences. As you can see in syrups or emulsion, but these all are prepared in a sterile manner. They must be sterile, free from any microorganism or their products. Then formulation of how the formulation of a parenteral takes. These all are formulated. The drugs are to be, so what they contain. First, they have therapeutic agents, active pharmaceutical in API. They must have therapeutic. Then they have various vehicles. The vehicles, they have water miscible in vehicle. Then they have non-aqueous vehicles. Similarly, they have added substances have to be added. When you learn in different dosage forms, some other addition has to be done. So additives means antimicrobials they can add, antioxidants they can add, buffers they can add, bulking agents they can add, chelating agents they can add, protectants they can add, solubilizing agents they can add, surfactant they can add, tonicity adjustment agent. So for a good formulation or under good GMP, they need these to be: one, therapeutic agents; second, vehicle; and third, added substances can be in a separate formulation as per requirement of the pharmacopoeia. They add this. Further is that during the formulation of parenteral products, the following factors are critical. What they are? The vehicle in which the drug is dissolved or dispersed, because that is more important. The solvent, volume of the injection. Then they go for adjustment to isotonicity. Volume, second, adjustment to the isotonicity. They must be isotonic. Adjustment of pH, stabilizers, preservatives, concentration units. This has to be added in parenteral products. Formulation of parenterals, what they do, they need therapy ingredients. For they can be used insulins, antibiotics, anti-cancer, steroids, vaccines, antipyretic, analgesics, anti-inflammatory. Large volume products like dextrose, sodium combination, etc. Large volume products. So the therapy agents means insulin for diabetics, antibiotics, anti-cancer, oncology products, steroids, vaccines, antipyretics, analgesics, anti-inflammatories, large volumes products like dextrose, sodium, whatever it is. So these are formulation of therapeutic. Still, this can we have more list of this antipyretic ingredients. Parentals, they need solvent, water should meet compendial as per the pharmaceutical requirement. They must be compendial. Compendial requirements, water miscible vehicles, they have ethyl alcohol, PEG, PG, non-aqueous vehicles, fixed oils can be added in the formulations. So aqueous solvents, the water for injections, sterile water for injection, bacteriostatic water for injection, sodium chloride injection, bacteriostatic sodium chloride injections, sterile water for inhalations, sterile water for irrigation can be added as a aqueous solvents with the parentals. So what's water for injection? It is the water intended to be used in the manufacture of injectable products which are to be sterilized after their preparations. Not required to be sterile, it should be free, limited from pyrogens. The total number of dissolved solids must not exceed 10 ppm. It is used within 24 hours of its collection. Water injection should be discarded or maintained sterile or stored in tight containers at 5 degrees Celsius for small volume, 80 degrees Celsius for large volumes. Now, sterile water for injection is there. Sterile water injection is a sterile, non-pyrogenic preparation of water for injections which contains no antimicrobial agent or added buffers and is supplied only in single dose containers. Now, it is used to dilute or dissolve already sterilized and packaged injectables, medications such as the dry powder of sodium phenobarbital and ampicillin, whatever it is required. So they must be soluble in this solvent. It is added under aseptic conditions. It must be pyrogen free, doesn't contain antimicrobial agents. It must be isotonic when intended for intravascular. So further bacteriostatic water for injection is that it is sterile non-pyrogenic preparation of water for injection containing 0.9% of benzyl alcohol added as a preservative. It is supplied in a multiple dose container from which repeated withdrawals may be made to dilute or dissolve drugs for injections. pH remains 5.7 to 7. If the patient will receive more than 5 ml of parenteral preparation, bacteriostatic water for injection is not the vehicle of choice. Why? Because it should be compatible with the drug. Sodium chloride injections. USP, it is sterile isotonic solution of sodium chloride in water for injections, contains no antimicrobial agent, may be used as a sterile vehicle in solutions or suspensions of drugs for parenteral administration. Further, we go for formulation of parenteral bacterial sodium chloride injection is that this preparation is designed for parenteral use only after addition of drugs that requires dilution or must be dissolved in an aqueous vehicle prior to injection. Further is that bacteriostatic 0.9 sodium chloride injection is a sterile, non-pyrogenic, isotonic solution of sodium chloride in water for injection. Each milliliter contains sodium chloride 9 milligram and zero point 0.9 benzyl alcohol added as a bacteriostatic preservative. May contain hydrochloric acid for pH adjustment. It is supplied in a multiple dose container from which repeated withdrawal may be made to dilute or dissolve drugs for medication. pH remains 5 to 7. Sodium chloride is chemically designated as sodium chloride, a white crystalline powder freely soluble in water. Non-aqueous vehicles. Solvent used must be consideration for selection solvent as vehicle for parenteral. They must viscosity, fluidity, boiling point, vapor pressure, miscibility, purity, ease of purification and standardization. Water miscible solvents can be given both IV and intramuscular. They may have glycerin, polyethylene glycol, propyl glycol, alcohol, ethyl oleate, isopropyl myristate, and dimethyl acetamide. These are water miscible solvents. Now, there can be use of vegetable oils. The most commonly used fixed oil in injection are corn oil, cottonseed oil, peanut oil, and sesame oil. Castor oil and olive oil have been used on occasion. Oil injection must not be administered intravenously. Now, added substances. The preservative have to be added. So, what preservatives, antimicrobial agents are added to multi-dose or small volume parenterals. Large volume parenterals must not contain preservatives. Ideal preservative must be first, they are benzyl alcohol, benzethonium chloride, methyl paraben, propyl paraben, phenol. These are the preservatives. Antioxidants. Antioxidants used to protect products from oxidation. So they act as reducing agent or prevents oxidation. Example is reducing agent. They are ascorbic acid, sodium bisulfate, sodium metabisulfate, thiourea. Blocking agents, ascorbic acid esters, BHT, synergistic or ascorbic acid, citric acid, tartaric acid. Chelating agent is EDTA. These are the antioxidants. Now buffers added to maintain pH. Change in pH may cause degradation of the products. Acetates, citrates, phosphates are generally used. Factors affecting selection of buffers. They must be effective range, concentration, chemical effect on the total products. The acceptable pH range is 3 to 10.5 for IV preparation and 4 to 9 for other routes. Buffers are needed for added substances. Buffers are included in injections to maintain the pH of the packaged product. However, the buffers used in the injection must allow the body fluids to change the product pH after injection. So hydrochloride, sodium hydroxide, acetic acid, adipic acid, benzoic acid, citric acid, lactic acids are used for the buffers over here. Constant adjusting agents. The osmotic pressure of blood is approximately 300 milliosmoles per liter. And ideally, any sterile solution would be formulated to have the same osmolarity. Example, 0.9 weight by volume, sodium chloride IV solution has an osmolarity of 308 osmol per liter, and 5% of weight by volume, dextrose IV solution has an osmolarity of 280 moles per liter. Intravenous solutions that have larger osmolarity values, they are hypertonic, or smaller osmolarity values, hypotonic, may cause damage to red blood cells, pain, and tissue irritation. Now you can see over the what happens to the RBC when hypertonic solution is and when hypotonic. In both, water is less, here it added over there. And in the shape of isotonic, you can see these are the normal RBCs. Hypertonic and hypotonic cannot be. So only isotonic solutions are added over there. Now then, after that, they go for sterilization. To removal of all type of microorganisms, they go for sterilization. So moist heat sterilization, steam, there is a dry heat, filtration, gas, ionizing radiation is there. Now, fish must pass sterility test. They must be free from. So after that, whatever the mode of sterilization is applied, maybe moist heat sterilization, dry heat, filtration, gas, what ionizing. It depends upon the nature of the product, which can tolerate that sterilization. Every ingredient, different injectable need different type of sterilization according to the requirement of that injectables. So sterilization is necessary for the complete destruction or removal of all microorganisms, including spore forming and non-spore forming bacteria, viruses, fungi, and protozoa that could contaminate pharmaceuticals or other materials and thereby constitute a health hazard. Since the achievement of the absolute state of sterility cannot be demonstrated, the sterility of a pharmaceutical preparation can be defined only in terms of probability. The efficacy of any sterilization process will depend on the nature of the product, the extent and type of any contamination, and the conditions under which the final product has been prepared. The requirements for good practices should be observed throughout all stages of manufacture and sterilization. So for the moist heat sterilization, steam, drive, gas, there are three different sterilization principles: heat sterilization, chemical sterilization, and radiation sterilizations. You can see various equipments which are used for sterilization.
सारे स्टूडेंट वेटिंग पर हैं.
नो, कोई भी नहीं ना, मैं साथ साथ चेक करता हूँ जैसे उनका ब्लिंक होता है. आपका who says that is on waiting? ब्लिंक जैसे होता है मैं उसको चेक कर लेता हूँ. देखना कोई नहीं, नो नथिंग है. 14 आए हैं आप लोग सिर्फ. Who said that he is on waiting? Whenever it is blink, so I can add over that. ठीक है? Who is on waiting? मोहब्बल आखिर में थे, वो आगे हैं. Who is after that?
सर माज इज ऑन वेटिंग.
No, मेरे पास ब्लिंक नहीं हुआ. मोहब्बल आखिर में आए हैं ये बस, और कोई नहीं है. नथिंग. मेरे पास जैसे ब्लिंक होता है मैं उसको ऐड कर लेता हूँ. So moist heat process is divided into three stages. है pre-vacuum stage है. ये जब when you go commercial product में आप देखना कैसे बनाए जाते हैं. Just for knowledge है. Moist sterilization है. Pre-vacuum stage है. Sterilizing stage है. Post. So you will understand when you internship will go to that do in industry में आप करेंगे तो आपको मालूम होगा कैसे heat sterilization की जाती है वहाँ पे. तो three stages: pre-vacuum stage है, sterilizing stage है, post-vacuum steam है. How they apply, when they apply the steam, that is moist heat sterilization. For the steam sterilization method, applying steam under high pressure equipment है autoclave. Mostly they are used क्या autoclave use किए जाते हैं. Mechanism microbial destruction, denaturation and coagulation of some of the organism's essential proteins. So it has to be done in steam sterilization. Sterilization is an autoclave or 15 minutes at one to depend upon the nature of the material that how long they can be lost for free from organisms. The temperature should be used to control and monitor the process. The pressure is mainly used to obtain the required steam temperature from 126 to 129, 134. So approximate corresponding pressure kitna hoga depending upon the nature how it is worked. Now steam sterilization application, there may be used ampoules, bulk solutions, glassware, surgical dressings, tools can be sterilized under steam sterilization. What are the advantages of that? Rapid, inexpensive, effective, large volume can be sterilized. Disadvantage, cannot use for oily preparation. Oil preparation cannot be used in steam sterilization. Cannot use for moisture sensitive preparations. In a dry heat sterilization is that you can see how the dry applied heating at atmospheric pressure, fan to be obtains uniform temperature by circle. So where circulation of air has to be done with the help of a fans. So it is a dry heat sterilization. Then dry heat sterilization is done. Method using heated air, equipment oven. Mostly the dry heat sterilization ovens are available. Mechanism microbial destruction, dehydration of microbial cell after oxidation. Usually conducted at 150 to 170 degrees Celsius for not less than 2 hours. Applications generally employed for substances that are not effectively sterilized by moist heat such as fixed oil, glycerol, petroleum, heat stable. So these are employed over the dry heat sterilizations. By filtration, the physical removal of microorganism or by adsorption on filter medium or a sieving mechanism. Now what they do, the sterile filtration is the process of separating all microorganisms from a liquid. A sterile filter must block all microorganisms in a flow of liquid without affecting product quality. Now types of various filtration is used. Millipore filters, which is thin plastic membrane of cellulose ester containing uniform pores constituting up to 80% membrane's volume. The pore size range from 14 to 0.02 micrometer. Small bacteria is 0.022 micrometer. Polioviruses of 0.02. So these has to be passed through these type of filters. These filters, you can see that different type of filters are used to check the bacteria. How this can be passed through this type of filter over here. Still by filtration, depending upon their size, microorganisms are not let through these pores, but instead collect on the surface. Is the most important reason, but not the only reason why filtration works. Now, smaller particles and microorganisms are retained in the pores due to adsorption process, depending on the pressure, differential, flow rate, number of particles, surface tension, and degree of ionization. Now, the material used, you may remember that one: cellulose, esters, nylon, polyester, polytetra, fluoroethylene, polyvinyl fluoride, polycarbonate, polypropylene, polysulfone, and polyether sulfone. In addition, hydrophobic or hydrophilic membranes are used. Now, gas sterilization. Gas sterilization involves exposure of materials, products to mixture of ethylene oxide or propylene oxide and an inert gas, example carbon dioxide, within a specially designed apparatus. Now, sterilization efficiency increases in the presence of moisture up to 60% elevated temperature up to this. Mechanism action of ethylene oxide is alkylation of hydroxyl, carbonyl, and amino groups of bacterial enzyme. You may have seen this disposable syringe written over the EO, mean these are sterilized under ethylene oxide. Due to highly penetrative nature of the gas medium, this technique is frequently used to sterilize medical devices, packs, package catheters, post-surgical accessories, blankets. However, this technique may also be employed for the sterilization of therapeutic agents, excipients. Due to toxicity of the gas mixture, sufficient time must be allowed after sterilization to enable the sterilizing gas to be dissolved from the product ingredients. The exposure to ionizing radiation equipment, ultraviolet lamp for surface sterilization, ionization, beta rays, gamma rays, X rays are applied in these ionizing radiations. Now, dry pharmaceutical products, heat labile products are used. These are applied over the dry pharmaceutical products and heat labile products containers. Now, disadvantage of this is that there are highly specialized equipment required. Effect irradiation on products and their containers. Now, sterilization and disinfection can be used. Sterilization refers to the use of different procedures to destroy all forms of microorganisms, including bacterial spores. Disinfection, it is a procedure intended to reduce microorganisms as far as possible, but not bacterial spores. Thus, disinfection can never replace sterilization. Disinfection can be accomplished with heat disinfection and chemical disinfection. The heat disinfection, it is accomplished by boiling water at atmospheric pressure for at least 5 minutes. Chemical disinfection, using phenol with cleaning component, destroy the membrane of microorganisms. Using 70% alcohol or IPA for skin, which denatures proteins of microorganisms. Use soap containing hexachlorophene for hands. In case of hepatitis, use 5% solution of chloramines or heat disinfection can be applied.